Hello. In ICD-10, Obsessive Compulsive Disorder comes under the section of neurotic, stress-related and somatoform disorders. From now on, I'm going to use the abbreviated term OCD for Obsessive Compulsive Disorder. I'm Dr Beth Colby, a psychiatrist in London. People with OCD experience obsessions or compulsions, or may experience both of them. These interfere with somebody's everyday life and their ability to function. Obsessions are irrational thoughts, ideas or images that constantly repeat in somebody's head, and compulsions are ritualistic behaviours that somebody constantly repeats. Obsessions aren't just worries about everyday problems. They are irrational thoughts, ideas or images that won't go away. They're unwanted and cause a lot of distress to the person experiencing them. People know that they're their own thoughts but find it almost impossible to control them, and these thoughts may lead to actions to actively dispel the thoughts, such as engaging in compulsive behaviours as a means of distraction. Compulsions are irrational and often ritualistic behaviours that somebody feels compelled to do and has to do again and again and again, such as cleaning, hand washing, counting, tapping, or double checking things. People engage in these repetitive behaviours for fear that something dreadful will happen if they don't. They may do this to expel the anxiety of an obsessional thought, such as the fear of somebody dying. These repetitive behaviours are seen as irrational, but people find them very difficult to stop doing them. So with OCD, the compulsions like checking, counting, washing are performed to reduce anxiety, and the symptoms tend to fluctuate with the underlying anxiety of the person. So for instance, somebody might have the obsession that their kids might die by being gassed, or the house is going to burn down because of the gas cooker. So the person might check and check and check again. The gas cooker is turned off, and they may go out and wonder, oh, is it turned off, and have to come back and check it, and it's off, then go out again. So all this coming back and forth and checking the oven is to dispel the anxiety of the thought that their kids might die or the house might be burnt down. As regards insight, people with OCD have insight into their disorder. They're aware that their thoughts are irrational and the behaviours that they have to repeat again and again and again are abnormal. As regards impact on life, people with OCD are very distressed by the nature of their behaviours or thoughts, however much they're able to control them. It affects all parts of somebody's life, including their work, and they feel personally affected by their disorder. Individuals can often feel guilty about their behaviours, and they may, for instance, ask that somebody takes their shoes off when they enter the house because of fear of contamination. And people with OCD often seek professional help to overcome the irrational nature of their behaviour. Finally, regarding time, the time it takes for people with OCD to perform all the rituals to neutralise the obsessions can be quite large. So for instance, all that cleaning every day, or washing hands, or checking the gas cooker. At the end of the day, somebody with OCD may regret all the time that they've done doing their ritualistic behaviours.